Welcome everyone to Afternoon Tea. I'm Dr. Linda. I am an emergency physician from Sheffield, and I'm here with my lovely co-host, Dr. Erica, who is a GP and she's tuning in from the West Midlands. We are both lifestyle medicine physicians, and do let us know in the chat below where you're from. I see somebody's from Links, and what tea are you having tonight? I'm having a decaf Earl Grey. And Erica, what tea are you having?
I'm having peppermint tea.
Oh, fantastic.
So every Sunday at Afternoon Tea with Docs, we bring experts to the table to inspire and empower you to enjoy good health by sharing fad-free information. In the audience, we've got people from all walks of life, so we encourage you all to ask questions because this is a great opportunity for us all to learn from each other. We particularly love to hear from non-medics and the sort of questions that you may have for healthcare professionals.
Did you guys know that 89% of all UK deaths are caused by lifestyle-related chronic diseases, such as cancer, chronic respiratory disease, diabetes, and heart disease, conditions which are actually preventable and very often are reversible? Genetics are not our destiny. Evidence-based lifestyle medicine is the growing specialty that addresses the root cause of the diseases, and it helps to prevent, treat, and even reverse these diseases. Today, we will be talking about one of the 6 pillars of lifestyle medicine, and that's sleep. And we are so delighted to have 2 guest experts with us, Nick Witton and Dr. Adrian Jeyakumar.
Hello.
Hello.
Hi.
Hello, both.
Hi.
So Nick Witton is a sleep specialist and performance coach. He holds a postgraduate degree from the University of Oxford in sleep medicine and is currently researching the effects of light exposure on performance for his master's. He is also he's also qualified as a cognitive behavioural therapist for insomnia and is a member of the British Sleep Society and the European Sleep Research Society. He regularly speaks, teaches, and lectures in the field of sleep management and works with businesses and elite athletes to improve individual performance, as well as business and team environments through sleep. He is also a patron of the Sidekick community charity.
Hello, nice to meet you.
Dr. Adrian Jeyakumar is a GP with an interest in further developing lifestyle medicine. He has a bachelor's degree in public health and epidemiology and is an international certified lifestyle medicine physician. Throughout his career as a doctor in the NHS, he has come to realize that medicine needs to be more proactive in preventing chronic disease throughout lifestyle education and consultations on an individual and population level, whilst it's also addressing planetary health and the more distal determinants of the well-being. Welcome to you both. Thank you for coming.
Hello, and thank you for that epic introduction.
Yeah, thanks very much. Having just a normal brew tonight, so.
Great.
Peppermint.
Suited for the sleep.
So I think Adrian has prepared a PowerPoint presentation for us as an introduction to sleep. Then we'll start our open conversation to dive deeper. And if you have any questions, please do keep them coming in the chat because it definitely makes for a much more engaging conversation when you start asking questions. So I'll hand the floor over to Adrian.
Okay, thank you very much. Let me just share this screen. Where's it gone? There we go. Is that all mostly visible? Excellent. Okay, so today I'm going to try and talk about sleep. It's a massive subject, so it's going to be very, very difficult to cover everything in one talk. In fact, it will be impossible to talk about everything in one chat. But I'm going to cover what I think is the important parts of sleep for us to know today. So let's just click here. So I'm going to go through the importance of sleep. I'm going to talk about how you would define sleep. I'm going to talk a little bit about the sleep architecture some basic physiology and the regulation of sleep. And I think that part's quite important, because once we understand these parts, we can start to see why we recommend some of the treatments that we recommend at the end of the talk. We're going to look at the health effects of sleep and a brief discussion on how much we need and the common causes that I see as a GP anyway of reduced sleep. Right, so let's begin. So we all know that feeling of having poor sleep, the horrors of trying to function on too little sleep, that lack of ability to concentrate, absolutely smashing down cups of coffees like there's no tomorrow, and desperately trying to get through that day without too much collateral damage. So we all know that immediate mental and cognitive and physical issues that lack of sleep brings. And yet, the long-term implications of sleep is still not yet fully recognized. But we do know that all animals and species that we've studied so far do need to sleep, although the architecture of their sleep may look somewhat different to our own. And with any luck, we'll spend a third of our life in blissful sleep. So if you think about this from an evolutionary perspective, back when we were hunter-gatherers, sleep's pretty dangerous for us, really. When you're asleep, you can't find food, you can't socialize, you can't protect your own community, you can't find a mate. It also increases your vulnerability to predation. So you would have thought there would be a strong evolutionary pressure here, really, to phase sleep out. And so for sleep to survive this evolutionary pressure, you can imagine that the benefits of this must be huge to outweigh its disadvantages. And this chap, who I'm not going to butcher his name, but he was a sleep researcher from University of Chicago, he said that if sleep does not serve an absolute vital function, it is the biggest mistake that evolution has ever made. Okay, so how would we define sleep? Well, descriptively, you might say it's a temporary and reversible state of altered consciousness with perceptual disengagement. Now, that has largely been superseded by EEG criteria, and this is where electrodes are placed on your scalp and your brain waves are recorded through sleep. So this next slide is it's called a hypnogram of sleep. And the idea of this slide is just to show you that when you're asleep, it's not nothing is happening. It's not this flat landscape of nothing. It's actually this complex landscape of you falling through different layers of sleep. And you can see here that you fall through non-rapid eye movement sleep, 1 and 2, which is the light part of sleep, into 3 and 4. And then you rise up again here into REM sleep. Now, the first 90 minutes of your sleep will largely be dominated by NREM sleep. And then the later parts of your sleep, the rapid eye movement sleep starts to sneak in. And I just want to draw your attention to these 2 spikes here. And you can see here that you're actually awake at some points during your sleep. And this is entirely normal. We all wake up at some point in our sleep, although we may not fully remember that. Okay. So what are the purposes of those NREM and NREM sleep? Again, this is still being fully elucidated, but we think NREM sleep is important in pruning extraneous circuitry for the memories that we've created that day. The deeper parts of NREM sleep are probably important for regeneration of tissue, bone, muscle, and it also strengthens our immune system. We do dream during NREM sleep, but it has a bit less of a narrative thread than REM sleep. And during REM sleep, this is thought to strengthen that already pruned circuitry. It links our memories to emotions. It improves our memory retention and recall. It's important in fear extinguishing with those memories as well. And we also know that you dream very vividly during REM sleep, but in this case, it has a very strong narrative thread usually. Oops, my mouse pointer gone. There we are. So this is just to give us an idea of the regulation of sleep. And this was taken from one of my favorite books on sleep, which is by Matthew Walker, called Why We Sleep. And it's just to remember that this is actually just a model. It's just a model depicting the regulation of sleep, and it can never fully show you the full complexity of sleep as it happens in real life. But you can see here that we have this process called process C, which is basically our circadian rhythm. And that will carry on through the day, 24 hours a day, and it will wax and wane, and it will be responsive to certain inputs. Now, everyone's circadian rhythm is slightly different, but the average circadian rhythm is roughly about 24 hours and 15 minutes. It's brought into line with the length of the day by our response to light. Essentially, we have a little organ in our brain called the suprachiasmatic nucleus that responds to light. I'll briefly talk about that in the next slide. But essentially, this circadian drive is our wake drive, and you can see that it waxes and wanes, and at about 11 p.m. it's dropping off here in this particular graph. There's another process going on called our homeostatic process, or our sleep drive here. Now, basically, every moment you're awake, you are depleting glycogen from your brain, and you're building up other chemicals like adenosine, which exert a sleep pressure. Now, as that chemical rises up here, you can see that your circadian rhythm starts to fall, and you'll get a very, very strong urge to sleep at this point. And through sleep, you'll start to clear this chemical, and it is only through sleep that you can clear that chemical. So you can see that if you don't get quite enough sleep, you will start the next day at a higher level of this chemical, and that will carry on if you don't get enough sleep to clear it, the so-called sleep debt. Now, whilst we can't clear that chemical apart from through sleep, there are ways that we are trying to change our response to it. And one of the most common ways is drinking loads of coffee. And what caffeine does is it interacts with the receptors that adenosine interacts with in our brain, and fills those in and blocks adenosine's effect, and essentially keeps us awake, stops that urge to go to sleep, but it cannot stop the rise of adenosine in your brain. So that will keep rising and rising and rising no matter what, as long as you're awake. So as soon as you've metabolized that caffeine and it moves away from those receptors, suddenly you'll get a flood of adenosine and you get an irresistible urge to sleep. And this is the so-called caffeine crash. Okay, so very quickly, one of the regulators of our circadian rhythms is responsive to light, and that enters through our eyes, passes through the optic nerves at the back of our eyes, and deep within our brain, we have something called the suprachiasmatic nucleus that samples the intensity and the wavelength of that light and passes messages on to another gland in our brain called the pineal gland. Now, the pineal gland produces melatonin when it's dark, and that melatonin corrals the rest of our brain into sleep. So you can see that that melatonin is switched off during daylight, as it should be, because we're meant to be awake, but it's also reduced if we have artificial lights at home, if we're watching TVs, backlit iPads, smartphones. All of these things can switch off our melatonin and affect our ability to sleep. There are other regulators of sleep, such as food, fluids, ambient temperatures, and social inputs. But this is one of the main ones, so we're not going to have time really to talk about those other ones, I don't think, in this talk today. So let's move to this. So again, this is just a very quick chat about the sleep physiology. And again, this part is important when we come to talk about sleep hygiene a bit later on. So you can see from this graph that as we're going off to sleep, our brain is producing melatonin, which is initiating our desire to go off to sleep. And as we go off to sleep, you can see that our core temperature needs to drop. And it continues to drop after we've fallen asleep for several hours. Now that will then start to rise later in the night. And as the sunlight comes back through our windows, it hits our eyes through the backs of our closed eyelids and starts to shut off our melatonin. And that will slowly wake us up. Now, there are some important physiological process going on through this sleep period. And there are things like your blood pressure starts to drop, and importantly, your sympathetic drive gets switched off. Now, this is our fight or flight or stress system. And when we don't sleep properly, this system doesn't really shut off at all. So it increases our blood pressure, it increases our stress hormones, It can lead to persistent inflammation and a reduced immune response as well. So you can see how a lack of sleep can give you a biologically plausible mechanism for reduced immune systems and leading on to things like cancers. Also throughout our sleep, we do get things like DNA remodeling and repair and hormonal regulation. And importantly, the hormones leptin and ghrelin, which control our desire to eat, our hunger drive, and our satiety drive, gets disbalanced. So we tend to eat more and we start to search out more calorific foods when we're sleep deprived, and this can carry on into the next day. So you can see as well why sleep deprivation can be linked with things like obesity and diabetes. So moving on, when you understand a little bit about the architecture and physiology of sleep, you can start to understand quite quickly what the benefits of getting a good night's sleep might be. And one of the important ones is that it boosts your memory and it boosts your learning. And it has been shown in some experiments that sleep deprivation can reduce your ability to make new memories by up to 40%. Now, 40% is a huge difference in making memories and learning. Healthy sleep also boosts your IQ. It helps you to think creatively. It helps you concentrate. It also helps you, interestingly, make ethical and moral decisions. And it also improves our physical strength. Other important things are it helps to reduce your risk of heart disease and strokes, diabetes, depression, obesity, and even your cancer risk. And in fact, insomnia is a very reliable indicator for hypertension, obesity, and depression, but also other somatic symptoms like increased muscle tensions, stomach upsets, headaches, and it's also they're all interlinked with insomnia. And there does seem to be this bidirectional relationship as well with sleep. So, for instance, if you are suffering with a mood or an anxiety disorder, or you have pain, that can affect your ability to sleep. And with that poor sleep, it also amplifies the mood troubles and the pain issues as well. And this might be an important mechanism with generalized pain disorders such as fibromyalgia as well. So how much sleep do we need? Well, this varies massively in the population, and it might vary due to your age, due to your life stages, health conditions, and your lifestyle patterns. But if we were to put a number on it, on average, you probably need somewhere between 7 to 9-ish hours per night. And below about 5 to 6 hours, you might start to see some of these detrimental effects that I've talked about, unless you're a short sleeper. However, short sleepers are pretty rare. And an interesting fact is that if you are sleep deprived for 24 hours, people have done studies to see what the equivalent blood alcohol level would be. And they measured it at around 0.1% if you were sleep deprived for 24 hours. And seeing as the blood alcohol limit in the UK is 0.08%, you can see that people that are sleep deprived, such as healthcare professionals after a night shift going home, might be driving in a cognitive state similar to someone that's over the drink drive limit. So how do we define insomnia? What is insomnia? Well, the ICSD-3, which is the International Classification of Sleep Disorders, say that it's the difficulty in initiating or maintaining sleep resulting in impairment of daytime functioning occurring 3 or more days per week for at least 1 month. I think more practically speaking, it's easier to say it's spending more than 30 minutes trying to get off to sleep, or the equivalent amount of time being awake after you have fallen asleep. So you can see that it can be a problem with both initiation of sleep and maintenance. So by daytime functioning, what I mean is things like mood disturbances, impaired concentration, daytime fatigue, and some people will report daytime sleepiness, which means falling asleep on your couch or a traffic light in the car, or in dangerous situations if you're driving a car. Now that's actually a red flag sign. So if those kind of things are happening, you do need to seek medical advice fairly quickly, because you may need to be referred on to an appropriate sleep specialist. The primary insomniacs, who are those that tend not to have a secondary medical condition, are those that couldn't take a nap even if they tried during the day, the so-called tired but wired population. So how big is the sleep problem in the UK? So insomnia with daytime consequences probably affects up to 8 to 12% of the population at any one time. And it's estimated that about 30 to 50% will experience insomnia symptoms within their life. The prevalence is definitely rising within the UK, and the age-specific rates seem to show steady rise across our lifespan as well. And women are affected more so than men. Now, this might be due to unique hormonal changes related to the menstrual cycle. It may be due to perimenopausal or menopausal issues at night, or bladder and urinary issues, especially after childbirth. Things like restless leg syndrome are also more common in females, and there may also be some gender reporting differences. So we're nearly finished, but the commonest causes that we see really of reduced sleep is, well, the first one is probably behaviorally induced insufficient sleep syndrome. And that is, in inverted commas, voluntarily not giving yourself enough sleep opportunity. So basically you're sleeping longer at the weekends, you're having to sleep late on a Sunday, so you end up going to bed late on Sunday and then waking up late on Monday morning because you'd gone to bed late Sunday night, and that the cycle continues. And this is associated more with people of younger age, alcohol use, or long working hours, stress and depression. And there seems to be a cultural issue in Western society and in the UK, where sleep seems to be associated with things like weakness or laziness. And the work culture is not really set up for the different chronotypes people have. So everyone is genetically predisposed really to either wake up early, very early in the morning, so-called morning larks, or later in the day, so-called night owls, or somewhere in between. But the work culture seems to only be set up really for, you need to get up early and go to work. The other causes that we do see are primary insomnia. This is insomnia that's not related to another medical condition. And it's usually due to suboptimal sleep hygiene. I'm not going to go into that just at the moment because I think we're going to talk a little bit more about that in the conversation part. It may be due to partner issues, whether your partner is moving a lot or whether they snore. Do they need to be investigated? Do they need to have a chat with their GP or a sleep specialist? Now, correcting your sleep hygiene is not a panacea. It will not cure all insomnia, even though everyone should be doing it. People with moderate to severe insomnia may need to have other treatments like sleep restriction techniques, and CBT probably has the most evidence behind it for treating this kind of insomnia. And occasionally you might need to use a mixed approach where you're using things like CBT and perhaps medication. Of course, medication is kind of a last resort because it does have other knock-on effects, like it changes the architecture of your sleep and potential addictive properties as well. So we try not to use medications if at all possible. So I'm not going to go fully through this slide, but it's just basically to give you an idea that there are lots of medical conditions that can cause difficulty with sleeping. But if you look closely, you can see that certainly a lot of them seem to be related to that or would respond to lifestyle interventions, things like obstructive sleep apnea and obesity, asthma and COPD, reflux disease, which is much more common in obese patients, diabetes as well, and also mood issues can also respond to lifestyle interventions. Now, a lot of these things might be covered in previous talks in afternoon tea and also in future talks, so I won't go fully into these right now, but I am going to hand you back to our hosts because I've been talking for ages, and we can have a conversation now, I think. So I'm just going to stop share 1 second. And whoops.
Thanks, Adrian. That was really interesting. That was very comprehensive and yeah, it's really interesting. I just wanted to ask as well. A lot of that research, is that as a GP, is that something you would have learnt while studying to become a doctor, or is that kind of extra research that you've picked up on because you're interested in it?
Yes, good question. Unfortunately, in medical school and through training, I can't remember having any teaching on sleep, unfortunately. So all of this stuff, it has been learned after, say, university or postgraduate education as well, and which is strange because it's so important. We don't learn enough about it during our medical school or postgraduate education at all.
That's incredible. I was talking to another doctor and they were saying that they had one lecture on it and unfortunately they missed it, so they weren't able to see it at all. And it seems fascinating that, from my experience, that sleep is the foundation to health and performance, and it's not looked at on at all at the moment. I think hopefully there are changes going on to try and interact sleep into underpin a lot of the training that you guys would do. But it kind of just resonates that is, systemic of what's happening in society, really. I mean, if the professional bodies are not taking sleep seriously, how can society in general and then the general population, look to try and concentrate on sleep? It's an extremely important area, and I know that Matthew Walker and other people have come out and discussed the fact that sleep's important, and now it's a lot more prevalent in society than it was, say, 5 years ago. But it's still undervalued. Do you agree that it's still undervalued?
Oh, definitely. And if I think back to my medical training when I was going through lots of different specialties, there's this culture of almost like bravado, like, oh yeah, I didn't get much sleep. It's I survived on 2 hours sleep last night. Isn't that great? And certainly in the surgical fields, there seems to be a lot of that, where you might be awake for 24 hours and still trying to work. And there has been studies, right, where they say sleep affects your ability to make moral and ethical judgments. So you've got a doctor or a healthcare professional running around trying to make these decisions, and they're finding it difficult to make ethical decisions or moral decisions purely because they're sleep deprived. And that makes literally no sense to me at all.
That's where you see some of the major mistakes occur. So there's a lot of huge disasters that have gone out there have been attributed to human error due to lack of sleep, such as the Chernobyl disaster, and the BP oil tanker slip was put down to a basic human error due to lack of sleep. But it's still kind of not thought of as the most important factor in people's lives. And that's kind of the message that you and I have spoken about before, to try and get this message across today, that as you said in your presentation, if you don't sleep, then not only are you putting your physical and mental health at risk, but you can't function to your best. You can't actually perform in the way that your body or your mind is intended to. And sleep is often the first thing that we all give up, really. So tonight, if we were allowed out and people wanted to go and socialize, then they wouldn't think twice about their sleep period. Or tomorrow morning, if you've got a busy week before Christmas, or you're going to go to the gym at 5-6 o'clock in the morning, it's the first thing that we're going to kind of all give up without even thinking about it. But the message really has to go across the day to say that it should be the priority. So when I'm working with athletes, we start with the sleep process, and then we work on to looking at training or food or chrononutrition, whatever it is. And so that's something that really should be valued. And I think that the first thing I do when talking to people who have got sleep problems is to try and get them to find out how much they value sleep. What's your perception of sleep? Do you see sleep as something that you can throw away, or do you see sleep as something that is integral to your well-being as well?
I wonder what kind of, because you said you worked with athletes, what kind of performance differences you see when athletes get a good night's sleep. What kind of impact does that have?
Well, in the athlete world, I guess they have a more time and more availability of trying to prioritize sleep around the rest of their functioning. You see some huge sports stars such as LeBron James or Roger Federer, trying to sleep for 10 hours a day. LeBron James actually has his own private sleep coach, and a lot of the athletes out in college in America actually employ sleep consultants to actually fix the time when they're going to be sleeping and then plan everything else around that. And you see huge increases in performance. It's also related to the circadian rhythm as well. So along the circadian rhythm, there are different points when all of us will have periods where we will be able to physically perform better. So it's a very easy way to test this. So if you go for a jog tomorrow morning, Adrian, at 6 in the morning, and you time yourself and you try and sprint to see as fast as you can go, or have the distance you want to go, and then you time yourself again at 4 o'clock on another day, or 6 o'clock or midday, whatever it is, you can see significant differences. And although they might be very small differences, to an athlete, that's a very important part. So that's called your chronotype. So that's related to your chronotype. So everyone has their own chronotype, and everyone is completely different in their chronotype. And what athletes do is they often try and train and perform to the times when they are either physically or cognitively performing at their peak. And in the business world, we look at cognitive performances. So there are different times of the day where you're going to be more creative. There are different times of the day where you're going to be able to problem solve or come up with solutions to kind of difficult tasks. And so what we're seeing now is that people are starting to realize this and start to plan their day and work with their employees at the time which is most suitable to them. Most notably with someone like Mark Zuckerberg, who doesn't pick up a meeting until 11 a.m. in the morning because he knows he can't perform to the level or be as sharp or be as effective unless he's performing to that time.
I mean, that's really, really interesting. And to talk about where you mentioned it's related to your circadian rhythm. And I heard that if you were to look at when all the world records were done, you would be able to find that they were done at particular times of days that seem to correlate with each other. And is that true? I mean, that's what I've
I don't know if they all are, but it might be true. I mean, it certainly would make complete sense. With sprinters particularly, people who are morning larks who are performing at 10 o'clock, 9 o'clock in the morning are much more proficient, much faster, much more able to do endurance training as well than they are in the evening. And so it makes complete sense for them to try and time their training to the time when they're going to be performing to their peak. And there'll be an ethical question to say that what time do we in the future? What time do we arrange training times, or what time do we arrange matches or whatever? But you can see in the future the science being there to prove that if you have a football match in the morning, you may select X player, whereas if you have a 8 p.m. match, there may be cause to select the right people. There is a way. You can't actually change. What's interesting to mention to people is that you can't actually change your chronotype. Your chronotype is a genetic disposition, but what you can do is over time learn to perform at that time. And with the most that we see that is in swimmers who often train before the pools get busy in the morning, and so they get adept to performing earlier in the morning than they would.
And to that question, for non-athletes, that was just a question that her 16-year-old unfortunately performs best at 2 a.m. in the morning. Can she change her sleep cycle to suit our daily social requirements? Is that something she could work on?
Well, I don't know if it would be advisable to work on, because I guess during that period your brain is going under the biggest change since you're a baby. So if she can manage her sleep and make sure she's getting enough sleep, unfortunately our society doesn't allow for for that time when you are going through the most physical hormonal changes in your body to actually fit in with our society. We still make students get up and be at school at 8 o'clock in the morning, which is completely ridiculous because, as you say, most of the time, they're going to be wide awake and alert. There is a natural shift that after adolescence changes, then you would go into a more kind of socially acceptable routine. So it will change for her. I think it's more about changing society than changing the individual, to be honest with you. And there you see schools, there's one in Germany and one in California that I know of, who have changed the start times to allow students to be able to, and there are results out there in the UK, they've done tests in the UK, that results that the performance in exams are dramatically higher to the students who are allowed to sleep in, allowed to work more around their chronotype, compared to students who are forced to kind of cut their sleep period short by sticking to a 9 a.m. lesson.
I agree with that. I think it really is a societal thing that needs to change. And if you think back to what I said earlier in the talk, that there has been studies showing that it can affect your ability to make new memories by up to 40%, perhaps even more, if it gets studied again. And this is an age group that is supposed to be learning. They're supposed to be learning at school, and you're putting a portion of them into a situation that's impossible for them to learn. So it doesn't make much sense to me. I think you're right. It is a societal thing. These are distal determinants that need to look at how we change that and get across how important it is that people need to sleep properly to be able to learn. And people do have different chronotypes. It is genetically programmed into us. And so therefore we need to adjust how society works for the complexity of human beings.
Definitely. I mean, that's not particularly much help there for Alison, for us, because we can't actually make that change. But what I would say to Alison is, and what the advice is to parents with teenagers, is to give them a break, is to realize that they're not doing this on purpose. They are more likely to be moody and grumpy having not slept properly. We are influencing that behavior, and we're expecting them to live to our routine, really. So the best thing you could do is get them to maybe have an evening routine, which I'm sure we'll get onto later, where they start to reduce the lights, make sure they're not having too much screen time too late, give them a 2-hour period where there's no screen time. And if they want to do something, they can read a book or learn an instrument, I don't know, whatever, something to just keep them, the lights low and the stimulation low as well. But then allow them maybe to sleep in. And if they are at school and they're working from home, maybe speak to the teachers and say, look, if they're working from home during GCSEs or study time, and say, look, they're not going to start until 11, because really and truly they're not going to be anywhere near able to perform or retain any information early in the morning. It's for example, for an evening person, an adult evening person who would naturally get up at 8 o'clock, 9 o'clock, being forced to get up at 5 o'clock and then start learning maths. You just couldn't do it. You just wouldn't do it. So give the child a break, give the teenager a break, give them as much support as possible. Realize that it's a horrible time of your life anyway, where you're physically and mentally changing. And the last thing you need to do, because they don't know they're fighting against their chronotype, they just react to it. So that would be my advice, and hopefully you see some happy changes there.
I would agree as well. It's optimizing as best as we can the sleep hygiene part that we'd briefly touched upon in the talk, and I'm sure we'll get onto shortly, but trying to optimize that as best as possible, and understanding and being compassionate about the fact that children and adolescents do have a slightly different phase shifted circadian rhythm compared to adults as well. Yeah, I think I would fully agree, and have a bedtime routine. Look at dimming the lights, using eye covers as well. Sometimes is quite useful for blocking extraneous lights, and be compassionate about the fact that if they do need to get up late, it's not necessarily because they're lazy.
Actually, you're mentioning eye covers. That was revolutionary for me in shift work. Do you guys, do you listeners use eye covers? Have you tried it before? Or earplugs? Do any of you use earplugs? You can comment in the chat. That will be interesting to see. how many people are actually using it. But it was definitely a fantastic addition to my sleep. Proper, comfortable eye covers and silicone earplugs that really helped. What is your advice on that, guys?
I agree. I think I've started using eye covers. I think they work very well for me. The earplugs is a difficult one. Sometimes I find they work very well. Sometimes what I find is they actually can increase your internal noise, so you can hear your breathing, or you can sometimes hear your heartbeat through these earplugs, which can actually be quite irritating. So it just depends. Sometimes it's about finding the correct earplug as well, using foam ones, and the silicone ones that really block things out and really occlude your hearing can sometimes increase internal noise, and so you might need to try a few different ones to see if which one works.
Yeah, and that's an interesting point. And I'd say that well, when you're asleep and you have your eyes closed, light still penetrates through your eyelid and still goes onto your ganglion cells, and therefore will start the counter of when you're awake. So if you are in a very lit room, then even if with your eyes closed and you're fast asleep, your body clock is going to start to be functioning. So that's why we see a lot of people struggling to sleep in the summertime, early in the morning, because they have a very bright room. The best thing to do is invest in blackout curtains, proper blackout curtains. I would make sure that if you are traveling to take an eye patch or 2 eye patches, and then just make sure that you are able to try and regulate the amount of light you get. And the reason that's important is because light is the main Zeitgeber, what we call is the main cue to your brain to know that it's daytime. So as Adrian said, it's a primeval function which stops us being predated during the daytime. When it's light, our predators could have seen us and they would have eaten us. So we have been trained to be awake during the daytime and make sure that we can then run away from those predators or fight them. And we still have that system now. So if you are having too much light during the evening time, then what your brain is saying is to stay awake, stay alert. You can get eaten at this moment. And also you can't find a mate and you can't find food either. So in the dark time, so stay awake and try and find food. So if that's the problem with these artificial lights that we have now in society, is that our brains haven't caught up with it and haven't caught up with the fact that we are able to now have 24 hours of light. So therefore, we are struggling, our systems are struggling to regulate our bodies to the 24-hour light and dark cycle. So light is hugely important. Sorry, regarding, I'm waffling here. So regarding to noise, some people actually sleep better with a little bit of noise. So some people use sleep well with a radio on. Some people, I know that there are a few athletes out there who use white noise apps. Because if they're in a very quiet room, they can start the rumination. They can wake up and really struggle to be getting back to sleep. So it's all very much for the individual, and it's a very easy way to find the best thing you can. I would say I would try not to have your phone next to your bed at all. So if you can find a way of having noise or blocking out the noise with no electronics, then you reduce the EMF. You also reduce the intention to have your phone in your bedroom as well.
Great. I mean, Nick, you study light exposure and its effect on our performance. So we don't get much daylight in the UK over the winter. How does that affect our sleep?
Well, yeah, it will hugely affect your sleep. So just to give people an understanding of light, light isn't just one box where it's either light or dark. So light is measured in lux, and one candle is 1 lux. In a room that we're all in now, probably it's a quite dark time, so I'd say it's around 250, 300 lux. And then if you go outside on a winter's cloudy day, it can be 10,000 lux. So the light difference is astronomical in measurement. However, our eyes are so brilliant that we're able to adjust very quickly. So that when you go outside and suddenly it's really bright and your eyes take a second to adjust, that's a huge change that's going on there. And there are some species who can't.
Yeah.
Yeah, someone agrees with that. I'm pleased. And I would definitely say that when it's on a really sunny day, it's around 100,000 lux. And so what's that? That's a lot of processing information that's going into the brain saying it's light, it's really light, you've got to stay awake, this is the time you need to be awake. So the reduced amount of light that occurs in the winter can have profound effects on the timing of your circadian clock, and that will then have a profound effect on when your sleep pattern and how your sleep pattern occurs. So the best thing that people can do is to try and get as much light in the morning as possible. It's kind of often called a photon shower. Get up in the morning and have a photon shower, and that's easily done. You can, if it's light in the morning, you can then, you know, have breakfast by a window, or you can go for a short walk, or if it's we did a study recently and we tried to have an intervention of having light in the morning. Unfortunately, we devised it in the summer and it occurred in the winter, and so when people were trying to get light on their way to work, it was still pitch black for a lot of people. So we intercepted this by trying to get people to go and have a coffee break at 11 o'clock by a window or outside for half an hour. And then we saw, you know, changes in their sleep. And you do see a huge increase in people's sleep. But we also, the last thing I'm saying is there is a natural, apart from the circadian rhythm that we have, which is 24 hours, which, you know, fluctuates and changes and responds to the day and light cycle. Yeah, they also have an annual rhythm as well. So there's evidence out there to support the idea that in the winter, as a species, we would naturally sleep for longer periods during the winter, and in the summertime, our ancestors would have stayed awake for longer periods as well. And you know, that's when you get things like changes in our behavior when we'll be harvesting or farming as well in those sorts of times. So if people feel a bit lower during winter time through the lack of lights, it's not uncommon, it's not unusual, it's very normal, and it is very related to the fact that you may be sleeping more. And it's okay to be sleeping more if you feel more tired, if you feel like your body's responding to it. The best thing you can do is, if you don't have to work long hours, is try and dim the lights. So put some candles on where it's safe and appropriate to do. Reduce the lux in your house as much as possible. Buy a salt lamp, and just try and make sure that in the evening that you're not exposing yourself to too much light.
I would second that, getting that daytime exposure as well, because it has been shown, I think, that if you don't get enough daylight exposure, that in the evening as well, you're much more sensitive as well to the artificial light in your home, and that suppresses your melatonin even more greatly if you haven't been exposed to daytime sunlight. But I think, even interestingly, there was some studies that looked at that even if you did go out into the sunshine in the middle of the day, that later in the evening, that's not even enough to combat fully the effect of the artificial lights in your house. So it's really important to try and dim those lights as much as you can. As you've said, Nick, I think, yeah, I would second that.
Yeah, I think that kind of links into the question here, is that can you sleep too much or oversleep? And that kind of brings us on quite nicely onto the sleep patterns in a week. So if the answer to that is that we all sleep for different periods of time. It's like we all have different heights. We're all different heights, so we all have different amounts of sleep that we need. Some people, as Adrian mentioned in his presentation, are natural short sleepers, and they can sleep quite perfectly well on 4 hours sleep. However, those people, as you mentioned, are very few and far between, and if you do sleep for 4 hours and you're not functioning well during the day, then you should definitely go and seek advice. But there are a very few people that function absolutely, actually they function better on 4 hours sleep than not. There are some people who naturally sleep for 10 hours a night. Roger Federer famously sleeps for 10 to 12 hours per night, and he can't perform well if he's having 7.5 hours per night. What is the right amount of sleep for you as an individual? Well, that's the same as testing whether or not how far you can run. It's the best thing to do is see how you feel, see how you function. I know personally I function very well on around 8.5, 9 hours worth of sleep. My girlfriend can testament that when I have about 5 hours sleep, I don't function particularly well at all. But that's me learning about myself on that. One thing to mention is that the sleep happens in cycles. So there's a 90-minute cycle when all of those non-REM and REM periods occur. And if you, at the end of that cycle, when you slightly wake up, you then go back into the next cycle. So if you can plan your sleep period in 90-minute epochs, you will sleep much better because you will wake up at the end of a cycle rather than in the middle of non-REM where you'll feel groggy or you'll feel overly tired or feel like you haven't slept very well either. You feel like, you know, it's not actually been a productive evening to sleep. So if you can plan either 5 epochs where you're doing 7.5 hours or 6 where you're doing 9, whatever is appropriate to you, you try and then time your alarm clock if you need one, or your sleep period of that time into a natural. So you should hopefully be waking up naturally without the need of an alarm clock, because you'll start sleeping more coherently with your body's natural rhythm. And yeah, and I think so. Sorry, the question was, can you sleep can you oversleep? People often sleep for long periods in the weekends, and the reason they do that is because they're sleep deprived during the weekday. So during the weekday, we all have social constraints where we've got to get up early in the morning, or we've got to stay up late at night, and therefore we're reducing the amount of sleep that our body craves and requires. And what happens then is, the weekend, people then stay in bed till 10 o'clock in the morning. It's a very natural thing to do, and this is called social jet lag. But the problem with that is that sleep isn't the same as saving money per se, where you can save different amounts on different nights and still end up with the same total at the end of the week. Sleep doesn't really work like that. The amount of sleep is there, but the quality isn't the same. Because if you're oversleeping, if you're sleeping for 10, 12 hours and your body doesn't need that sleep, then the effects of sleep is not as effective as if you were sleeping to the amounts that you need, because the REM sleep will change, the non-REM sleep will change, and therefore restorative processes won't occur. So that's why people are not functioning well, and we have a health problem, because you end up having people who think they can catch up their sleep and bank their sleep, and it's just the science is there to show us that that doesn't occur.
And there was a link. There was a link between, as it is lifestyle medicine, and there was a link between a lack of sleep and chronic diseases. And from a societal point of view, shouldn't we be more, more determined to bring the information to government and kind of demand for better sleep patterns for our society as a whole, because of the side effects that we can see of Alzheimer's, dementia, cancer, and other serious complications that we see on the long term. Was there any action in the past that you have heard of where we demanded change in this field, or are we silenced about it and we don't know, we know so little about sleep? Because if we find out, then we might go against the economical need of our government and societies.
Yes, yeah, definitely. I mean, why do we sleep in the fashion that we do? Because of the light revolution and the industrial era. It was the change where we needed people to get up out of bed and go to work, and now we've come into a system where, as you said quite rightly, Adrian, there's a badge of honor about being the first person in the office and the last person there. I mean, not in any office I've ever worked in, because it becomes quickly apparent that people cannot perform correctly or well enough or sustain health, which is why you see burnout around 40 years old. People are burning themselves out and risking their health. And our ancestors, actually, quite interestingly, there's some evidence out there that our ancestors actually used to sleep in 2 blocks. So we sleep in one singular block, whereas our ancestors used to sleep in 2 blocks. The first from when it got dark until around kind of 1 o'clock, 2 o'clock in the morning, and then they would naturally wake up. And they'd get up, and they wouldn't just wake up, they'd get up. They wouldn't just get up, they would get out of the house. They would go out of the house, they'd go for a walk, they'd socialize in the street. There would be occasions where people would have a meal in the middle of the night. And then they'd go to sleep for a second period. Because if you think in how dark it is for the winter months, it's dark for for a long period of the day. And so it was broken up into sleeps. The invention in the industrial era has got rid of that, and it squashed people into sleeping in one singular block, which may be one of the reasons why we see people struggling to maintain their sleep throughout the night period, because our body hasn't really adjusted to it.
Yeah. Yes, I fully agree with that, and I think as you were talking about a badge of honor, it also sets up a culture of when people teaching other people that it's okay to be, or they should be tired, saying, well, I went through it, so you need to go through it. I'm your teacher, and I had to suffer, so you have to suffer, and that doesn't make a great deal of sense as well, in my opinion. And to how we change that culture, I don't know, actually. I think that's a bigger thing, like you say, bringing information to governments, having ethical corporations look at their sleep policy. That would be a fantastic way to deal with it, I suppose.
I think if we have learned in medical school the detrimental side effects of lack of sleep, I think we would have quit really early on in our medical training.
Well, you used to do surgery, didn't you? So during your surgical career, you must have had lots of that, being awake for 24 hours and having to operate the next day. And how can you do a complex operation the next day on no sleep? And if that patient knew what your cognitive functionality was with that lack of sleep, would they be happy to have that operation?
Totally.
It's an interesting question.
I mean, there's links out there to say that 5 nights of continuous sleep of only having 6 hours or less is the same as being drunk to the point of being over the limit. Your cognitive performance is the same. So if your surgeon has had 5 nights of poor sleep, which is only 6 hours, I'm not saying it's 4 hours or 3 hours, I'm just saying it's lower than 6. If they are doing that, then their cognitive performance is the same as someone who we wouldn't allow to drive legally. And you wouldn't ask your pilot to have a beer before they go on takeoff, but you're quite happy to, if they haven't slept for 5 days, we don't even test for that. So that kind of underlines the importance of sleep, and I think it's fascinating talking to GPs and doctors who have seen firsthand, who are forced to not sleep very well, but they're also not taught the value in it as well. So it's really interesting.
Yeah, I am just a little bit conscious of time, and I know lots of people would probably want to know about kind of advice on how to improve their sleep. And I know Adrian touched on the word sleep hygiene earlier, and that there is if you can tell us a little bit about what kind of advice that you actually give to people when they come to you for sleep advice. And I see a question from Katie as well, who's a GP. What do you do when the standard sleep hygiene advice doesn't work?
That can be tricky, can't it? So well, I suppose we need to go through exactly what I mean by sleep hygiene. And really you're looking at, if there was one of them that was probably the most important, it would be setting a schedule, making sure you go to bed at the same time each day and wake up at the same time each day, irrespective of the day of the week, whether it's the weekend or the weekday, to give we're creatures of habit. So giving us that regularity conditions us to when we're supposed to go to bed. The next thing I would probably say is making sure that you're getting enough exercise. And I'd refer people back to a previous afternoon tea where exercise was the main topic of discussion, getting 150 minutes per week of moderate intensity exercise, but trying to keep that at least 2 to 3 hours away from your bedtime. And it's also interesting to note that if you've never done exercise before, you might find that exercise actually worsens your sleep for a little bit. But as you get fitter and more physically capable of being able to deal with that exercise, it actually improves your sleep along with all the other health benefits of exercise. But it would still go along with keeping that more than 2 hours or 3 hours really away from your bedtime, perhaps even more, because the hormones, the adrenaline running through your body when you sleep and the raise in your body temperature will affect your ability to actually fall asleep. It's really important to look at things like what stimulants you're taking, as Nick mentioned. Things like coffees and teas and even chocolate are really important to look at. And people think that decaffeinated coffee doesn't have any caffeine in it, but that's just not true. It does have caffeine in it, so that can still affect your sleep. And remembering that caffeine tends to stay in your body for a long period of time. Its half-life is roughly about 5 to 7-ish hours. Now, half-life doesn't mean that it in the next 7 hours it's gone away. It actually follows something called zero-order kinetics. First order kinetics, I can't remember exactly which one it was now. I think it was first order. But essentially it means that you need to go through about 4 or 5 half-lives before you've actually got rid of that caffeine from your body. So it would still be affecting you. Trying to avoid alcohol is a really important one. Now, that's kind of a long-ish answer, but I'll try and keep it short. Basically, alcohol affects your architecture of sleep pretty badly. You tend to lose REM sleep in the early part of the night, and then you tend to get a lighter portion of sleep later on, which you're more easily woken up from. And this is a rebound effect as the alcohol is metabolized, and the metabolites can actually wake you up as well. It can affect your breathing during sleep, and it's also a diuretic as well. So you might have to get up to go and wee. So it's not really a good idea to drink alcohol. And if you do, to maybe stick to 2 to 3 nights a week and stick to the guidelines of 14 units or less per week for men and women. Trying to avoid large meals before bed as well, because that can cause things like reflux. Again, the same with lots and lots of fluids before bed, because you might have to get up and wee. Things that people miss commonly, which might help a little bit with what if sleep hygiene is not working, is to really delve into that sleep hygiene. And some people are taking medications that affect their sleep that we don't know of. So things like over-the-counter medications, there's loads of analgesics that people are taking that contain things like caffeine, or cough mixtures that have stimulants in them that might keep people awake. And from a GP point of view, looking at their medications, is there anything that we're giving them that is affecting the architecture of our patient's sleep as well? And perhaps either modifying the time of day that they're taking it, or changing them to an alternative medication. The next bit of advice I would probably recommend is trying to avoid napping late in the day. So if you're kind of tired and you think you can sleep, try not to nap after about 3 or 4 p.m. because that's going to affect your ability to fall asleep later in the day.
And I'd also add to that as well, sorry to jump in, is that if you do suffer from clinical insomnia, the advice is to not nap at all, no matter how tired you are, because it's just going to compound the issue as well. Sorry, just jumped in.
Sure. And following on from that, I would say making sure it's you're giving yourself the opportunity to relax before bed. Don't overschedule your day. Have a worry period during your day where you look at all your worries several hours before bedtime and then put those to rest so that you're not worrying about them in bed. Taking a hot bath is actually quite useful. Now, it's not because it warms you up. It actually is because it vasodilates you and it allows your body to lose temperature quickly so you can go off to sleep. So having a hot bath before bed is really important, and avoiding things like salty foods, because that affects your ability to vasodilate as well, and therefore cool yourself to when you go off to sleep. And on that note as well, making sure your room is cool enough so that you can go to sleep. So around about 15 to 18 degrees Celsius is probably what we would recommend. It's always easier to fall asleep in a cooler room than it is a hot room, as everyone will probably know in some blistering days in the summer. Making sure your room is dark with blackout blinds, as Nick mentioned, and making sure it's comfortable. So you've got comfortable bed sheets and pillows, and it's gadget free, again, as Nick mentioned earlier. And again, correct daytime exposure, waking up with the sun and turning the lights down before bed. And importantly, if you can't get off to sleep, if you find yourself lying in bed, and you're lying there for more than 30 minutes trying to get off to sleep, don't lie there. Get up. Go and don't watch TV though. Don't stick your iPad on or look at your phone. Keep those off. Maybe read a book, do something relaxing, meditate. Perhaps use an app like Medito or Insight Timer, which have very good meditations on them. And when you feel ready to go to bed, you feel tired, go back to bed then, because the anxiety of lying in bed thinking you can't get off to sleep can keep you awake. And the second thing is you can quickly associate your bedroom with being awake. And that's exactly what you don't want to do. Yeah,
exactly right. I totally agree. And that kind of goes to Sean's question as well, who's asked about waking up in the middle of the night. And I think what you said there, Adrian, you hit the nail on the head. Sleep hygiene is basically a set of practices. That's all it is. It's been given a nice term for it, but it's literally a set of practices. And these practices are important for you to value your sleep and take your sleep as seriously as you can, because it's not often until we lose sleep that we start to realize the importance of it. To reiterate what you were saying there, Adrian, is that one of the major problems is that people often wake up in the middle of the night, and it's that feeling of, oh God, I'm awake again. I can't get back to sleep. This is going to be terrible. And then they try and get back to sleep. But one of the things to realize is that good sleepers don't actually try and get to sleep. They just naturally give up being awake. And so what you can do is some cognitive behavioral techniques. I know somebody else mentioned that in the chat. So CBT is hopefully a way of distracting the brain. So the way I work with some of my clients is getting them to memorize their all-time favorite cricket team, which is enough to send anyone to sleep, really. Or getting them to plan a route around the world and try and name all the countries in the world that they can think of. It's just something that is dull and normal to get your brain stop thinking about your daily life and stop the rumination occurring. And then just to back up what Adrian's saying is that in the middle of the night, the main problem is that people become an association with their bed as being awake, and you want your bed to only be there to sleep, really. And so therefore, if you're going to bed and you're lying there for an hour before you can get to sleep, you're most probably going to bed far too early. I think 25% of people in the UK go to bed up to an hour before their ideal bedtime. So they are going to bed because they feel that they need to go to bed early because they didn't sleep well the night before, and then they're awake because their brain is alert, or they haven't had that 2-hour period of kind of relaxing their brain and reducing the light. So it's trying to associate your bed with only sleeping. So as Adrian said, if you wake up in the middle of the night, get up and get out of the bedroom. And you can prepare for this event. So you can have ready a blanket, a book, a candle ready, or a salt lamp ready, where you can go to. And that kind of relieves the tension of saying, look, I probably will wake up again. The likelihood is in my lifetime that I am going to wake up in the middle of the night. But when I do, it's not a big problem. I've got control of the situation, and I've got things in place to help me deal with this problem. Yes, it's frustrating. I would rather be asleep, but my brain has said, let's get up. In the middle of those cycles, when the time we're into light sleep, your brain has kicked into gear because you might be having a high stressful period, or you might have things on your mind, or which can be anything really. And therefore your brain is kicked in, but you're ready to deal with that, and you're ready to say, okay, I'm going to spend an hour here reading until I feel tired, and then I'm going to go back, and then I'm going to try and not get to sleep, but I'm going to try and give up being awake. And it takes the stress out of the problem. And exactly what Adrian said is the problems that we see with people sleeping is that they either have a disbelief, wrong beliefs about sleep, or they have too much anxiety around not sleeping, which is just going to compound the issue.
And I also wanted to go back to just part of that question, what else can we do? As you said, there are other things like CBT that we can, hopefully in my locality, it's difficult for me to refer to for CBT, but there's online CBT as well that people can look at. There's also sleep restriction techniques, which are sometimes used, but that's probably best done under a sleep specialist. And essentially what that's doing is it's reduced the time spent in bed. So you need to keep a sleep diary basically for several weeks to look at how long you are spending asleep, and trying to restrict the time you spend in bed to the amount of time you spent asleep, but not less than, say, 4 to 5 hours, and then gradually increase that time spent in bed. But again, those are things I think would probably be best done under a sleep specialist to look at that, unless you're very happy to continually follow up that patient and have the time to do so.
Mm-hmm. Yeah, and then the last thing to add there is to talk about monitoring of sleep. And one of the major causes we see of bad sleep or anxiety around their sleep period is the over monitoring of sleep. Nowadays we have watches or apps which can tell us how long we sleep for. However, the problem with that is that they will give you estimations on how much non-REM sleep or REM sleep that you've had, but there is no way that they can monitor this. So they don't actually have the ability to record your sleep architecture, which is the quality of sleep. You know, have you had lots of REM sleep or have you not? It's an estimation based on your movement. So you could be lying there completely awake, but very still, thinking about the world going past. But your clock will tell you, your watch will tell you that you're fast asleep and you could be in REM sleep because you're not moving at all. And the problem that we see with that is people, they equate the quality of their sleep to what the watch tells them as. So they'll look at their watch in the morning and say, oh, I got 85% quality sleep last night. I feel great. And the next night they might have the exact same sleep period or very close to it. And the watch will say, oh, you had 35%. And you wake up that morning worried and anxious about it. But the truth is it's an accelerometer. So it can only measure the movement and can't measure your sleep architecture. I see that John has mentioned the list technology, the light button, which is a really good button as well. And I've liked that technology, and I know the guys who run that. But I think, again, it's the over monitoring of things. If you can have a feeling, an endogenous feeling of how your sleep period is, then you can start to manage it yourself and you can start to control it yourself. And when it does break down, have practices in order and ready that you can actually change and make those changes yourself. You know, take responsibility for it rather than trying to over record it.
I think people would be interested in sleeping tablets and melatonin. Adrian, you mentioned about melatonin, and could you just tell us a little bit more?
So, well, melatonin in my locality is actually not GPs. We don't prescribe it, and it's not the same as these other hypnotic sleeping tablets. I.e., it can't send you off to sleep. It's basically, melatonin works like a starting gun, basically to get you to the edge of sleep. And I think we had a conversation with Nick where essentially, if you're taking it at the wrong time of day anyway, it's not going to have any effect. But certainly in my locality, GPs, we don't prescribe it. It's basically, if we've referred off to a sleep clinic, a neurological sleep clinic, they sometimes prescribe it for various things like REM sleep disorders and what have you. They sometimes use it, and we take over the prescribing as, say, shared care. But more commonly, what we get is people coming in for things like Zopiclone or Temazepam or those kind of things, saying, oh, Doc, I can't sleep, please, can I just have some sleeping tablets? And that is tricky because the problem with sleeping tablets is that they're a bit like alcohol. They just completely destroy your architecture of sleep. You lose REM sleep, you lose the rejuvenating qualities of sleep. So there has been links that it damages or it reduces your immune system, so perhaps increases the rates of infections in the elderly population. You get a hangover effect the next day, so you might get people quaffing loads of caffeine, try to counteract that hangover effect from the sleeping tablets. And not to mention, as everyone knows, that it's physically and it can also be psychologically addictive, i.e., even if they need it in their drawer to know it's there just to go to sleep. And when you do develop a tolerance to sleeping tablets, the issue is that some people, they take it and then they can't sleep with it and they can't sleep without it. And that's a really, really difficult situation. And of course, we know that sleeping tablets have been linked with other things like all-cause mortalities and road traffic accidents, etc., etc. But that being said, we as GPs also need to try and maintain a relationship with our patients. And if you automatically say, no, I'm shutting the door on this and I'm not going to give it to you because it causes a massive problem, you've immediately put a barrier up with your patient, and sometimes using it for very short periods and in certain situations for a few days to reset the cycle, perhaps up to a maximum of 2 weeks. Sometimes you may well use it, but as long as you've explained these things to the patients, you've made an agreed management plan saying this cannot be forever, this needs to be stopped, we need to have a management plan on how you're going to come off this, then, and they understand all the risks of it, then sometimes we need to be mindful of our relationships with our patients as well, and try to help them reset their cycle a little bit. But I agree, sleeping tablets is a very difficult one, because everyone thinks they're going to cure all their problems, but actually they create more problems than they solve. And if we do use them, then it should be for very, very short periods with a very agreed management plan, how you stop them and when you're going to stop them, so the patient is fully aware of what's going to happen, I would say.
I think this brings us back to the beginning of the conversation, where Nick asked us if doctors are trained in sleep. And I think neither doctors nor patients know much about sleep. And if we would, and we would be educated, then we could give advice more assertively and make our patients feel comfortable with our advice, because we know what kind of lifestyle changes they need to take, and we can reinforce that. So that's where we come back to lifestyle medicine and bringing that into our everyday practice, and how important it is, and how many changes we could bring to our patients when we learn to talk about things outside of medications, and not focusing on it, and actually giving them solutions instead of just a prescription.
Yeah, and quite often actually I've found that when I've explained the problems with sleeping tablets really well, and patients understand, you take the time to explain it, quite a lot of the time they don't want it. They just say, actually, do you know what, I'll try something different, because yeah, I think, yeah, taking that time and explaining it, and a lot of patients are turned off by the idea for hypnotics. Of course, some of them aren't, and you have to deal with that part as well. Yeah, it can be tricky. And
for those who are now unfortunately addicted to sleeping tablets, what advice do you guys have for them, and what can they do to wean themselves off? Are there any services in the UK that they can go to? What is your advice?
That is quite a tricky one, actually. Services wise, I mean, I suppose that the main way to combat that is to try and stop them being on it for long periods in the first place, and actually having a really good management plan about when they're going to come off of it. Once they're actually having problems with it, it's going to be a case of following them up quite regularly, and perhaps even weaning them slowly off of these medications, reducing them by a certain number, an agreed number per week. The problem is that if you take them away, the anxiety of you taking it away can also cause a problem with the patient's sleep. So reducing it gradually, and being compassionate with your patients about the problem with being addicted to sleep medications is sometimes useful, I think. But that's a tricky one. Every patient is different, and that would be about shared management, really, I think, with each person.
I think the other avenues to explore for GPs is to firstly to say that there are a lot of other opportunities before Z drugs prescribed, such as cognitive behavioral therapy for insomnia, sleep restriction therapy, sleep education, just things that we've been talking about, lifestyle medicines today. But there are also a good connection to a sleep clinic is really important, I think, in the local area. So if you can then refer, because then the full understanding of how sleep is impacting the life, and how life is impacting the sleep, can be explored fully. And I would recommend, I would really hope that in the next 5 to 10 years that we see a connection, not only an increase in education for our doctors, but also a connection to sleep clinics for most GPs.
I agree, and being able to talk with your patients quite well about sleep, I think that does stop them using prescription medications quite effectively. And I'll be honest, I can't actually remember the last time I prescribed a hypnotic medication, because after taking the time to speak with my patients, I find that a lot of them just don't want it. So yeah, I can't actually remember. There must have been a time at some point, but it's been a long time since I prescribed one.
Yeah, I think there's a point on the chat about wanting to feel heard, and I think a lot of people often want to take a pill and solve a problem. I think that's part of who we are as a society now, and I think that if we can try and get to a point of having a conversation and getting a better understanding, and that's why I'm doing things like this to widen the education out there on sleep, because you're going to spend a third of your life asleep. So if you live to 90, 32 years of your life you'll have spent asleep. And if you don't know or learn about it, and if you're only going to try and solve the problem by taking a prescription drug, then it's not actually going to solve the problem. So yeah, so I would just education be the first port of call, and then a connection to a sleep center where they feel that the problem is being addressed as well would probably be the last call.
Yeah. Yes, it would be fantastic if we had a multidisciplinary approach to our patients, and we could refer our patients to a sleep expert. That would be a dream, right?
A dream.
Indeed.
No pun intended.
Yeah.
Yeah, that's a good comment. Should we run through a few questions, if we can do a few bullet answers to them? Erica, would you like to read out a few that you feel could be answered quickly? And
yeah, so Preet had a question on the no big meals before bedtime. If people are really hungry, what would you suggest as a late night snack?
I would probably try and stay away from things that are very carbohydrate rich anyway, because they're known to take you to the sleep-wake transition, basically. So certainly sugary foods, but carbohydrate rich foods you probably want to stay away from if you're really, really hungry at night. And that would be the major one, but also trying to avoid hunger at night. I suppose what's happening during the day that you're so hungry at night, and looking at your meal plan in the day and see whether you can optimize that in a way that stops you being that hungry at night.
Perfect. Nick, question to Nick. Erica?
I'm slow at reading.
I would just say, Adrian, yeah, I mean, I totally agree with that, and it's a lovely approach. And the next time I have an ailment, I'm going to definitely come to you, because you seem to be looking at the bigger problem rather than just trying to solve it. So, but I would also say, food-wise, that some people, there's a lot of kind of double page spread in the newspaper about what foods are best for sleeping, and the truth is that this is quite commonly poo-pooed in the scientific community. You're not really going to take have a kiwi fruit and fall asleep. There are some foods that are higher in melatonin, such as fish, kiwi fruits, cherries. But if you're having them very late at night, then your melatonin onset has already occurred during the dim light period, so probably around 2 hours before you start to feel like you're going to fall asleep. So it's kind of pointless trying to take melatonin at the wrong time, or trying to take some sort of food to try and initiate sleep. However, if you do want to take kind of a relaxing kind of tea or something like that, an afternoon tea with doctors or an evening tea with doctors, I think that is something you could have, like a herbal tea, and that will just relax you and calm you down and de-stress you, and also it begins a routine, and it says, right now I'm beginning the sleep time. Now the lights are going down, I'm having my herbal tea, I have my hot bath, and I'm taking this seriously, and I'm doing what I can, and I'm giving myself the best chance to sleep properly. So that's what I would say. Yeah,
routine is super important. I wish I had some routine in A&E, but that's another topic altogether. As long as my patients are feeling better. That's good. Very good.
Question about magnesium supplements for sleep, and also vitamin D levels being linked to sleep, but must be taken in the morning. What have you got to say for that?
Yeah, so you've got there are certain, so magnesium doesn't naturally occur in the body, so it has to be ingested. So there is evidence out there that short sleepers have higher levels of carbohydrates and fat in their diet, and they also have lower levels of iron and magnesium in their diet. And this is short sleepers around 5 hours per night. So there is evidence out there, but it's all individual. And I'm not a doctor, but I would say that hopefully Adrian will testimony to this, that we're all individuals. So, you know, what levels are in, you know, magnesium levels in my body might be completely different to somebody else's. And so unless you properly know that, I mean, taking supplements when you might not need them could just be, you know, either pointless, or there could be a placebo that's making you feel better and then helping you sleep. You know, what would you say, Adrian?
Yeah, no, I would fully agree. I mean, I do know a little bit that low levels of vitamin D, of course, are linked with some issues with sleep, but and pretty much everyone really in the UK at our latitude should be taking some form of vitamin D. So that's one supplement that yeah, okay, yeah, you should be taking that usually. But magnesium, I would agree. I'm not fully certain that I would myself recommend that to anyone to take it up, and I'd probably look at other things causing the problem with sleep as opposed to taking a supplement.
Yeah, and yeah, totally. And vitamin D really is, it occurs in the body because natural sunlight forces the body to then produce vitamin D, but it doesn't occur through windows. So the UV light will not be able to penetrate through, or the right wavelength of light will not be able to penetrate through and cause your body to produce vitamin D. So those people in the winter, particularly if you feel like you need vitamin D, if you're showing symptoms of lack of vitamin D, then get outside, go for a walk if you can. If you have to work from home, a good tip here is if you have to work from home and somebody calls you and it's not raining, put your jacket on and take the call outside and go for a walk whilst on the, and everyone I work with or everyone I know does something similar, and it's just you're getting your steps in, you're getting your daylight, and also yeah, you know, it works.
All the health benefits of exercise and its beneficial effects on your sleep as one of the pillars of lifestyle medicine.
Thank you.
Excellent. Fantastic answers. Thank you so much. If we don't have any more burning questions, I think we will be moving on to our breathing exercise, which will also be supportive of your sleep. And Erica will be leading that, unless you have anything else to add.
No, thanks very much for all the comments, everybody. It was really interesting, and it's lovely to talk with you all as well. Thank you.
Lovely to talk with everyone, and yeah, thank you for all the questions. It's been fantastic.
Great. It's been a super interesting session, and there is so much to talk about sleep, and we wanted to talk about, you know, sleep and weight management as well, and that, you know, that is a huge topic in itself. So we would probably be talking about that in February in our weight management and microbiome month. So if anyone's interested in that topic, please do go to our website and have a look and join us in February to talk about that in more detail, because that should be a really, really interesting conversation as well. So in terms of the breathing practice, if you could just get into a comfortable position, we'll be doing the same breathing exercise as last week. So sit on the floor cross-legged if you like, or if you're on a chair, then with your back straight, or lie down on the floor or on your bed if that feels more comfortable. And have your eyes closed. And we'll be breathing through our nose only today. And remember not to use our shoulders or our neck muscles to breathe. We want to concentrate on our belly. So as you breathe in, your belly should be pushing out and rising. And as you breathe out, your belly will be falling. So for today's breathing pattern, we'll be doing a breath in for 4 counts, and then we'll be holding for 4 counts, and then breathe out for 4 counts. I'll start with the counting, and then you can carry on at your own speed. Okay, so let's begin. So breathe in through your nose. 1, 2, 3, 4, and hold. 1, 2, 3, 4, and out. 1, 2, 3, 4. In through your nose. 1, 2, 3, 4. And hold. 1, 2, 3, 4. And out. 1, 2, 3, 4. In again. 1, 2, 3, 4, and hold. 1, 2, 3, 4, and out. 1, 2, 3, 4, and just carry on at your own speed. Just remember, belly rises as we breathe in and falls as we breathe out, and our shoulders shouldn't be moving up and down. So in through your nose. 1, 2, 3, 4, and hold. 1, 2, 3, 4, and out. 1, 2, 3, 4. In again. 1, 2, 3, 4, and hold. 1, 2, 3, 4, and out. 1, 2, 3, 4. Now just breathe normally, keeping your eyes closed. And as we come to a close, just notice how you're feeling now. Notice that maybe you're a bit more calm and mindful than you were a few minutes ago. And I invite you to try this out when you're feeling stressed in the next week. And try to repeat that breath cycle about 10 times, and that should take you about 2 minutes. And now just slowly open your eyes. Great.
Thank you so much. That was brilliant. Oh, I'm just waking up. Bit hypnotized. Thank you, Erica. Did you guys enjoy that?
That's fantastic.
I liked it.
So that's a good practice to incorporate into your sleep hygiene. Thank you so much, guys, for this incredible conversation. I was mesmerized and I learned so much as a doctor as well as a patient. And we really hope that we can, and if you agree, bring you back in February, because it seems like our guests are really enjoyed this session and a lot of interaction happened. And what's better than to talk about weight gain, obesity, and sleep in the new year, and to set us up for a new and full 2021 that hopefully is going to be a bit better than our last 2020. but maybe we'll still be in lockdown, so hopefully everybody can still join us on a Sunday. Thank you so much, Adrian, and thank you, Nick. Both of your details will be on our website, so if anybody would like to interact and get in touch with them, then you can do so on afternoonteawithdocs.com. All the details will be there. We do have a forum now, so you can continue this conversation if you have any questions to our experts. If time allows and they're happy, hopefully they will get back to us. As well as we have a membership area where you can sign up, and it's all completely free, just so that we can continue this conversation and bring evidence-based lifestyle education to both of our doctors and patients. If you tune in next week, we will be talking about narrative medicine and how it can actually change our practice and how our patients can benefit from approaching our medical conversations from a narrative point of view. So we hope you tune in. You can get our free tickets on Eventbrite as always. Get it from Afternoon Tea with Docs. It's always free and will always be, just so we can give you evidence-based information. So thank you very much, guys. Thank you, Adrian. Thank you, Nicholas. And maybe we catch up on the forum.